So now moving to the second mechanism in the other category, that is drugs affecting metabolism. Drugs affecting metabolism, and the most important metabolism is that of folic acid. So first we'll discuss how folic acid metabolism occur. Three substances: pteridine, para amino benzoic acid, and glutamate. So these three substances, they combine together to form folic acid. The folic acid which is formed is dihydrofolic acid. I'll write it as FH2, dihydrofolic acid, and the enzyme is known as folic acid synthase. So the name is easy. It is helping in formation of folic acid, so it is folic acid synthase. But the folic acid, it is inactive. It cannot produce any action. It must be activated. And what is the active form? Active form of folic acid is folinic acid. Folinic acid is the active form of folic acid, and folinic acid is nothing but tetrahydrofolic acid. So dihydrofolic acid is inactive, tetrahydro is active, and we want to convert dihydro to tetrahydro, we need to reduce this. So the enzyme name is dihydrofolic acid reductase. So dihydrofolic acid reductase work and convert dihydro to tetrahydrofolic acid, and tetrahydrofolic acid is active. It can help in formation of DNA. Folic acid help in formation of DNA. So through this pathway, human cells as well as bacterial cells are forming DNA. So if we want to stop the bacterial growth, we need to stop this pathway. And how we can stop? We have two methods. We can inhibit first, we can inhibit second enzyme. If we inhibit any of these enzymes, we will stop DNA formation. The first enzyme is inhibited by drugs called sulfonamides. Sulfonamides inhibit folic acid synthase. Whereas second enzyme is inhibited by drugs like trimethoprim, pyrimethamine, and methotrexate. So trimethoprim, pyrimethamine, and methotrexate, they inhibit dihydrofolic acid reductase. Now, if we use number one drug, it is bacteriostatic. If we use number two drug, it is also static. But when we combine the two, that means number one plus number two, that means the drug which inhibit both the enzymes, then the combination is cidal. So individually, both the drug groups are static, but the combination is cidal. Okay, so we will discuss these one by one. First, we will discuss sulfonamides. Sulfonamides. Their names start with sulfa. The drugs in this group include, they all start with sulfa. Examples are sulfadoxine, sulfacytine, sulfasoxazole, sulfamethoxazole, sulfasalazine, sulfadiazine, sulfacetamide, and one drug which do not start from sulfa, it is dapsone. So most of them start from sulfa, and one drug which do not start from sulfa is dapsone. And important thing to remember, because they are starting with the sulfa, so they are also called sulfa drugs. Sulfa drugs. And in which context you have read sulfa drugs earlier? Sulfa is important regarding, yes, allergy. So sulfa drugs are known to cause allergy. So sulfonamides can cause allergy. And if a person develop allergy, person will develop skin rash. Obviously in allergy there is rash. So if you want to remember about sulfonamides, you must know the ABC of rash. So you must know the ABC of rash. So in that we will complete our sulfonamide ABC of rash. A for aplastic anemia. A for aplastic anemia. So sulfonamides can cause aplastic anemia, leukopenia, thrombocytopenia, all can occur. Then B for bilirubin displacement. B for bilirubin displacement. What do we mean by bilirubin displacement is, this is our blood, this is bilirubin. So bilirubin normally do not remain free in the blood. It always remain bound to albumin. So this is albumin. Now when we give sulfonamides, now sulfonamides have high plasma protein binding. They bind to albumin. And now sulfonamide, they start fighting with the bilirubin. Sulfonamide say that I will bind to bilirubin. So when sulfonamide bind to albumin, the bilirubin will become free. So bilirubin is displaced, bilirubin become free. Now, even though bilirubin has become free, it will try to enter the brain. Bilirubin try to enter the brain, but it cannot because there is presence of blood-brain barrier. So even if the bilirubin has become free, it do not cause any problem in a normal person because there is blood-brain barrier. But if the barrier is not there, then this bilirubin can go inside the brain. And this bilirubin can deposit in the basal ganglia of the brain. And the deposition of bilirubin in basal ganglia is called as, yes, it is called as connectress. So normal person connectress will not occur. But when it will occur? When the blood-brain barrier is not there. And when the blood-brain barrier will not be there? In newborn babies. So sulfonamides are contraindicated in newborn babies because they can result in connectress. And remember, connectress, it is ending with icterus. Icterus, we use the word icterus for, yes, jaundice. For jaundice, we use the word icterus. And you can remember, it is neuronal icterus. So, connectress means neuronal icterus. That means bilirubin is depositing in the brain, basal ganglia of brain. So, if we give sulfonamide to the newborn baby, it can result in connectress. Okay. So, we were discussing the sulfonamides. In sulfonamides, we remember them by ABC of rash, and we discussed A for aplastic anemia and B for bilirubin displacement leading to connectress. Then coming to C means crystalluria. So sulfonamides can result in crystalluria. They are not soluble in the urine. So they can come as crystals in the urine, that is known as crystalluria. And if the crystals are big enough, they can cause obstruction, that can cause renal failure. So what is the solution? What is the most important advice given to these patients? Take plenty of water. Plenty of water must be taken, otherwise sulfonamides can cause obstruction. They come as crystals in the urine. And if a sulfonamide more soluble, it will have less risk of crystalluria. So the maximum soluble sulfonamide is sulfasoxazole. Sulfasoxazole is most soluble, so it has minimum risk of crystalluria. Maximum soluble, so minimum crystalluria. So you can remember from the name says SO means soluble. So most soluble is sulfasoxazole, so minimum risk of crystalluria. Okay. Then R for rash. We all discussed sulfonamides can cause allergy. In fact, they are a very common cause of Steven-Johnson syndrome. Steven-Johnson syndrome, the most common antibiotic implicated is sulfonamides. Then A for acetylation and S for SLE. Remember, sulfonamides are metabolized by acetylation. They can cause SLE. Which are the other drugs in this group? Yes, these are ship drugs. Remember ship drugs? Sulfonamides, hydralazine, isoniazid, procainamide. So 4 drugs, they are metabolized by acetylation. They can cause SLE. Sulfonamide, hydralazine, isoniazid, procainamide. Then last point also we covered in the Journal Pharma. They can cause hemolysis. In which patient? In patient with G6PD deficiency. So sulfonamides can cause hemolysis in patients with glucose 6-phosphate dehydrogenase deficiency. Okay, so these are the important points regarding sulfonamides to remember. We remember them by ABC of rash. ABC of rash. Okay, so that is important about the sulfonamide as a group. Okay. Now regarding the individual sulfonamide, if we want to revise the important points, remember sulfacytine. Sulfacytine is shortest acting, whereas sulfadoxine is longest acting. Sulfacytine is shortest acting sulfonamide and sulfadoxine is longest acting sulfonamide. Then the important sulfonamide, which is sulfasalazine. Sulfasalazine. The important point to remember, it is used in ulcerative colitis and Crohn's disease. Used for ulcerative colitis and Crohn's disease, and sulfasalazine is a prodrug. Sulfasalazine is a prodrug. Then the next sulfonamide, which is sulfadiazine. Sulfadiazine, particularly its silver salt, which is called as silver sulfadiazine, commonly written as SSD. Silver sulfadiazine. It is used for burn dressings. For burn dressings. So what happens is when the person develop burns, the skin already become dry. This silver salt of sulfadiazine, it attract the moisture. It keep the moisture, so skin remain little moist, and along with that antibiotic property of sulfadiazine is there, so it is used for burn dressing. Silver sulfadiazine. And the last drug, which is dapsone. Dapsone, you need to remember, dapsone is a sulfonamide. Its name do not start with sulfa, but it is a sulfonamide. It is used for, yes, everyone knows it is used for leprosy. Dapsone is used for leprosy, but the examiner also know that, everyone know that dapsone do not contain sulfa in the name, but still it is a sulfonamide. What is special to remember, dapsone is used in leprosy, we know, but examiner also know that, everyone know dapsone is used in leprosy. So they ask a question, dapsone is a drug of choice for, but leprosy is not in the option. So where we use dapsone, in which skin condition it is drug of choice? Yes, it is dermatitis herpetiformis. Dapsone is drug of choice for dermatitis herpetiformis. Dapsone is drug of choice for dermatitis herpetiformis. Very important to remember. Okay. So these are the important points regarding the first group of folic acid inhibitor, that is sulfonamides. But one important thing is left. What is important? Are pus. Pus contain plenty of PABA. Pus contain plenty of PABA. Remember, sulfonamides are competitive inhibitor of folic acid synthase. The structure of sulfonamide is very similar to PABA. That's why they are competitive inhibitor. But if there is presence of pus, lot of PABA will be present. So if we see the competitive inhibition, it is surmountable. So if the substrate is more, we can stop that. So pus do the same thing. So if pus is present, sulfonamide become ineffective. So just remember, sulfonamides are not effective in presence of pus. Sulfonamides are ineffective in presence of pus. So that is very important thing to remember. Wherever there is pus, sulfonamides will not be effective. Okay, so that is about the drug inhibiting folic acid synthase. Now moving to the second drugs, we discussed that in this group, the second enzyme which convert dihydrofolic acid to tetrahydrofolic acid. This enzyme is dihydrofolic acid reductase. And we discussed this is inhibited by three drugs: trimethoprim, pyrimethamine, and methotrexate. Now the question is, although all three are inhibiting the same enzyme, but they have totally different uses. Trimethoprim is antibacterial. Pyrimethamine is used for treatment of parasitic infections, whereas methotrexate is used in cancers. The question is why? When they are inhibiting same enzyme, why they are used for different indications? The reason is, although they inhibit the same enzyme, but they have different affinity in different species. Trimethoprim inhibit the dihydrofolic acid reductase mainly in bacteria, so it is used antibacterial. Whereas pyrimethamine mainly inhibit in parasites, so it is antiparasitic. Whereas methotrexate mainly inhibit in humans, so it is used as anti-cancer. And from the name you can easily remember, pyrimethamine P for parasites, methotrexate M for man, and trimethoprim in bacteria, tria. In bacteria we have tria, so it is trimethoprim for bacteria. Okay, so these are having different species specificity. But if they inhibit the enzyme in humans, what can be the side effect? So little bit of inhibition can be occurring in all species. So if they inhibit in humans, what is the side effect of all of these drugs? Yes, they inhibit in folic acid metabolism. So all of these are involved in causing megaloblastic anemia. So all of them can cause megaloblastic anemia as a side effect. Okay. Now methotrexate we will discuss in cancers later on. Trimethoprim and pyrimethamine are not used alone. They are always given in combination with sulfonamide. Remember, the combination is sidal. Individually they were static, but when we combine them with sulfonamide, the combination is sidal. So that combinations we need to discuss. So we have two combination. One is combination of trimethoprim. Second is combination of pyrimethamine. So we will discuss one by one. The first combination is called as cotrimoxazole. Cotrimoxazole. It is a combination of trimethoprim with sulfamethoxazole. So combination of trimethoprim with sulfamethoxazole is called as cotrimoxazole, and from the name you can find it is saying that it is a combination of what? Combination of trim with oxazole. Oxazole means sulfamethoxazole. It's a combination of trim with oxazole, cotrimoxazole, cotrimoxazole. Now, when we were testing this combination in the laboratory, we found that the maximum number of bacteria can be killed when they are in a particular ratio. And what is that ratio? The maximum killing occur when the ratio is 1 is to 20. Maximum killing action occur when the ratio is 1 is to 20. So then we developed a tablet which contain 1 part trimethoprim and 20 parts sulfamethoxazole. But when we gave it to humans, the ratio in the blood changed. The simple reason is these two drugs have different volume of distribution. These have different absorption. So in the blood, different amount reached. So when we checked the blood sample after giving the tablet, the ratio became 1 is to 80. Obviously, we did not want 1 is to 80. What we wanted in the blood is 1 is to 20. So what we did, we changed the ratio in the tablet. So this is the ratio we want in the blood. So in the tablet, we change the ratio to 1 is to 5. So the tablet ratio is 1 is to 5, and when it is taken goes into the blood, it ratio become 1 is to 20. Clear? So if you can see in the market, the tablet comes out of 480 milligram. No need to remember the dose, just the idea I am giving. 480 milligram tablet comes, out of which 80 milligram is trimethoprim, 400 milligram is sulfamethoxazole. So it become 1 is to 5 ratio. So tablet ratio is 1 is to 5, but when it reaches the blood, it become 1 is to 20. Okay, so you need to read carefully. The question asked is, what is the ratio of sulfamethoxazole to trimethoprim in cotrimoxazole tablet? Options will be same. Option will be 1 is to 5, 5 is to 1, 1 is to 20, 20 is to 1. So you need to see which ratio they are asking, whether they are asking S is to T or T is to S. Remember, sulfonamide is a longer name. It's a longer name, so it will be more. So whether 5 or 20, it will be for S. And even more easy to remember, S for sulfonamide, S look like 5. S look like 5. So sulfonamide will be 5. So if it is S is to T, answer will be 5 is to 1. If it was T is to S, answer would have been 1 to 5. Okay. Now second question can be asked, what is the ratio of sulfamethoxazole to, or we can change the question now, ratio of trimethoprim to sulfamethoxazole for best bactericidal action. For best bactericidal action. So what ratio we want for best bactericidal action? That's for best bactericidal action, we want the ratio as 20 is to 1. But what 20? 20 should be sulfamethoxazole, so it should be 1 is to 20 here. Okay? So read carefully two things. One, whether they are asking in the tablet or they are asking in the blood. That means best ratio. Second, whether S is written in front or behind. So wherever S is written, that will be bigger. 5 is to 5 or 20 will be at that place. 5 in case of tablet and 20 in case of blood. Okay. So that is important about the ratio. And this cotrimoxazole, it is drug of choice for Punjab National Bank. Cotrimoxazole is a drug of choice for Punjab National Bank. What is Punjab National Bank? It is pneumocystis, nocardia, and Burkholderia cepacia. Burkholderia cepacia. So pneumocystis, nocardia, Burkholderia cepacia. The drug of choice is cotrimoxazole. Okay. So this is the first ratio, bactericidal ratio. Then second drug, which is bactericidal combination, it is combination of pyrimethamine with sulfadoxine. Pyrimethamine sulfadoxine combination is also cidal. This is also cidal, but this combination is used for P means parasites. This combination is used for parasites. Which parasites? Mainly for malaria and for toxoplasma. This combination is used for malaria and toxoplasma, but unlike cotrimoxazole, it has not been given any specific name. So it is simply called as combination of pyrimethamine with the sulfadoxine. You can remember P for pyrimethamine, P for parasites. So it is used for malaria and toxoplasmosis. Okay. So that completes our second mechanism in this video. That means drugs acting on metabolism. Okay.